So now we are moving to the last case, the 10th case. Today we realized 5, and yesterday 5. And this is also a new, we will use new tools. I will start with this one. This one, it's very new, only 2 or 3 months on the market. I mean 2025 in the last month. Is so-called dual access sheet, dual ClearPetra. Why dual? Because we have here 2 channels. Yes, now it's better with like you made the video. So one is for, in fact, both are for wire guides. One is for safety, and one is for work. So this is a very nice idea, because we need sometimes a guide, a safety wire. Yes, in the beginning we use this safety guide wire. Is good because the ureter must be in your hands. I mean, with safety guide, you are, I think, it's much better for the safety. I have to emphasize that in the last years we didn't use this kind of guide wire. I mean, for safety, because everything was with flexible, that we can see everything, and it is not a problem. But I think for everybody, in my view, the second one is for radiology. So from this I can put a guide, and for this I can use the contrast media, okay, and I can see perfectly what happened into the ureter, UPJ, and of course into the kidney. So this is completely new. It's Wellead, and it's 11 French, and I think it's a very, very interesting tool. So nowadays, now we have to move to our case. This Pusen 9.2 French with the working channel 5.1 French. It's the biggest working channel in the world, and this is new. They started in 2024, but in 2025 this kind of ureteroscope was used in many special centers, academic centers, or in centers with great experience. Why is the best, this one? Because is with suction, but in the same time is with great working channel. 5.1 then means more than 1 millimeter. They means 1.5 millimeters. It's good because the fragments could be extracted. This is really very nice tool, and we published some our experience with this one, and I'm so glad to also to operate with Pusen. Pusen being one of the great companies in the world in endourology and of course in ureteroscopy. So we already put it the access sheet. It's a ClearPetra access sheet, and it's this case. Yes, please. You put the water. Very good. Okay, no problem. Now, yes, good. Very nice. Good. Sorry for this. Okay, so now we will put the connection for the, the suction. This is the suction. This is the, the flow. And now we will enter into the access sheet. This case, and we will wait for the presentation. So please.
In this case, we perform surgery at a patient male in age 36 with stone dimension 11.2, 10, 40.6 millimeters, and another stone with 4.9 per 5.58 per 6 millimeters, with a stone volume over 900 millimeters, and the second stone with 86 millimeters cube. Stone density was 1440 Hounsfield unit, with urine culture negative. In this case, we use single-use flexible ureteroscope from Pusen with 9.2 French, with a working channel with suction, ClearPetra Access Sheath with suction new models, with 12 per 40 diameters of the access sheath, Charriere, and the Polaris loop Ureteral stent, and Storz Multilase TFL with 60 watts from Quanta system.
Okay, now please come here with your mobile camera and look to the irrigation. This is access sheet with suction. It's perfect way to control and not to have high pressure into the kidney. Look, it's perfect working. So let's go now, and please move to the endoscopic view. This case has a little particularity. It's a case in which the stone was stuck into the ureter. I think into the Pyelic, into the UPJ. We will see. Look, this is the ureter. We will try to enter here. Yes, this ureter. We are going now up and up, and now look, the stone, like I told you, is exactly fixed in the UPJ. It's a little bit difficult, because sometimes this stone is difficult to treat, but it's a particular position. And now we will put the laser, the fiber, and this fiber, it's the one of the thinnest that I saw. It's a fiber from Storz, and it's a fiber with only 150. I mean, the center of the fiber is very, very, very thin. It's sometimes it's difficult to work with this one, but it's okay. We can see perfectly. Now I need water. Yes, good. Now it's okay. So let's try to, yes, to treat the stone and maybe to move the stone into the kidney, because the stone is just in the UPJ stenosis, in the UPJ zone. Now it's perfect. We have two problems here. The first one is the position of the stone exactly in the UPJ, obstructive, semi-obstructive, And now we try to fix this problem. Yes. Let's see, it's better now, okay. Let's see now, it's okay, it's better. Let's see, good. Now it's better, but the problem is also with the movement, you know, respiratory movement. Sometimes it's very difficult, but, you know, we fix the laser here and we treat this stone exactly in this position. Very difficult position because it's just in the UPJ, it's fixed here, but no problem. We'll continue. Look to the respiratory movement, very strong. This position, it's sometimes very tricky. Sometimes you don't have very good vision. But now we have the chance that, you know, the vision is very good, no problem. And we treat this stone like this. Yes, okay. Let's try to. In fact, what I would like to make is to fragment the stone like this and to enter into the pyrocalyxial system, not to treat in situ like this. Once again, ureteroscopy. In ureteroscopy, you need patience, a lot of patience. Now it's moving. Yes, it's moving. Oh, good. It's moving a little bit. It's better now. Let's see. Yes. This is the particularity of this case. With the stone that is tucked into the into the UPJ. I need to grow up to, yes, the frequency and maybe 40 and 0.3 joules. Okay, now let's see. Now let's see, because the stone is very, very difficult to destroy this stone and to move this stone. Now the power is better. Yes, the wall is there. It looks nice now. Yes, the stone is already treated near the wall, but we have to continue here and here. It's not only, you know, this stone has also, you know, it's a very fine, very, very near to, it's completely obstructive. Okay. Let's try. Let's try to enter here. Look, now it's the first time that we see the wall. Look, this is the Pyelic wall. The first time it's here. Good. Now we have to continue the movement. Oh, be careful. The wall is very close. Now, this is the UPJ. Very, very difficult case. Very difficult case. Sometimes this case could be a nightmare. Why? Because, you know, everything is stuck here. And the mucosa It's very, very, you know, you can obtain a bleeding in 1 second. Look, here was the stone. Here and here, here, here. Look here. Now it looks nice, but in the beginning was a nightmare, you know. The problem, now it's okay. We can enter with the access sheet, and this is free of stone. Yes, here it's a little bit, no problem. I can push this stone into the kidney. It's not a problem for this. Okay, okay. But, you know, sometimes I saw a lot of complication here because this is very fragile. And this is, you know, if you treat here and here, you can obtain a high bleeding. And everything you must stop. We stop some operation like this, some procedures. Look here. Here was the stone, here and here and here. Now everything is free. Now you can see perfectly. It was no easy, not at all. And now we are into the kidney. Good. Now it's another story. We are very happy. It's clear. It's not a problem. Now we can treat the stone in classical mode. Yes, this one, look. This is, and also here, it's edema. So it was, yes, it was a very, very tough case, very tough case. Yeah, very tough case. And now let's go into the calyxes, because we need to see the fragments and to treat these fragments. And having this great ureteroscope, we can extract the fragments using, of course, the suction. Look, you can see perfectly the calyxes are dilated. Look here, and look here, and here. It was a very important obstruction. And look here, look how this is a specific aspect of calyxes. I mean, with a big obstruction. Exactly, this is the, you know, specific aspect. Very nice, very instructive aspect. Very, very good case. Of course, difficult, but very instructive. So this was the superior calyx, I think. Now we have to go to medium calyx, medial calyx. Okay, it's here. Also here, look to the, this is also a very nice image. You know, look to the papilla. The papilla is here, and here you can see, here maybe we will see some fragments after our, yes, there are fragments here, perfect. And we have to treat these fragments. Yes, very good. Fix the stone, fix the kidney, please. Okay. Up. No, fix the kidney, please. If you look to this laser, it's also from you know, it's Storz. It's very good laser. It's one of the best lasers, and is also from family, Quanta family. Look to the retropulsion. It's very low. I can treat the stones without problems. Look, I am very near to the stone, and the retropulsion is very low, very, very low. Look here, look here. Imagine holmium. Imagine holmium, classical holmium. Wow. In this situation, imagine your fragments will be everywhere. It's not possible to treat like that. Everywhere will be your fragments. But look here, very nice. You can treat perfectly the stones. no movement, no retropulsion. Look, no retropulsion. Very, very nice. Look, you can treat exactly the stone. All the movement of the stone is not from my fiber. No, it's from irrigation. Because the fiber, look to the fiber. No retropulsion. Really very, very nice. So, we will try to use this system of aspiration. I told you, look how it works. Look, clear, clear, clear. It's great. So let's go to another calyx. Okay. This was superior calyx. And now I have to go. I think we will try to enter now with access sheet in order to make the aspiration with also with access sheet. It's the combination. It's very good, this combination. We use this one in many situations. Why? Because it's a reason of time. Yes, it's a reason of time, and also, we have to, now, we are here, and look. Look, these are the stone. Come on, come on. The stone will be with us. Very good. You need a lot of time, but in this situation, give me water, please. Now suction. Good. So with suction, you can resolve this problem very quickly, like matrix. Suction, please. I don't know. I can enter here. Yes, it's okay. Let's go. Very good. Very good. Let's go. Also, the time reason, and it's, look, completely so free. And look to the, look, this is the position of, initial position of the stone. Very difficult case. And look, no bleeding, perfect view, perfect case for demonstration. Good. Now put the WJ, please. Okay. 0.3 joule, and here 40 hertz. That means we use 12 watts. It's not at all much. It's the best. And with these lasers timing, it's safety. This is very important. It's very efficient in the same time. And also, this case was very demonstrative. This very difficult case was very demonstrative in, in the end of the day, no lesions, 0 lesions on the ureteral, on the UPJ, and the pylocalyceal system. No lesions. So I think it's really, really great. So now they put the WJ, also Polaris. I think it's a very nice option, because this WJ has in the bladder these 2 loops, very fine, very we have a lot of bladder irritations after classical WJ, and also reflux. Reflux could appear, and there are some studies in which this WJ, it's 70% less of reflux, and of course for bladder irritation. So I think they already put the WJ. Yes, you can make this one on the radiology. The WJ is here, And also it's important, 0 residual stones. Look here, no stones here, 0. 0, and look here, the double J, it's here. Okay, so I think that this is, yeah, we started from here, look to the stone, it's, this stone, it was here, big stone, and the position was very difficult, and also, and look, the final image of this procedure. So they will finish now. The WJ, everything is okay. Now they will put, I think, the catheter. No. Yes. Okay. And of course, I will. It's a great occasion for me to finish this workshop with some words. You know, online surgery and online endoscopic surgery, it's sometimes very difficult because, you know, in life there are a lot of things good and not good. The complications, the difficult situation, like this one, for example, could appear. Not a simple stone in a Pyelic system, 1 centimeter, it's enough. No. This is not educative, it's not instructive. I think this kind of Ureteroscope workshop, you know, we try to demonstrate the new technology and of course safety, more safety and more efficiency. And I am so glad because everything was really perfect. In the end of the day, I think that all the cases were completely resolved and perfectly resolved.